Well, several different public health protections and financial aid programs will continue for another 3 months after the Biden administration extended the federal public health emergency over the weekend.
KXAN's Avery Travis has more on why nursing home operators hope these programs will help them tackle critical staffing shortages inside their communities.
You are the first line of information, first line of care.
But after spending years as a certified nurse aide, Lori Porter knows nursing home staff aren't always treated that way. Federal labor statistics show staffing levels in hospitals nationwide have now increased after an initial drop. But employment continues to decline for nursing and residential care facilities. Experts say that's been a problem since before the pandemic.
This is becoming the roller coaster we can't get off.
The Texas Healthcare Association advocates for Texas nursing facilities. Its president says staffing is the biggest cost to home operators, which is why programs funded by the newly extended public health emergency are critical, including an additional nearly $20 per resident per day.
Do we know how many of the homes in Texas use some of that money to increase wages or do preventative things to try and keep staff from leaving or quitting?
It's really all the above.
He describes everything from hero pay for existing staff to the high costs of travel nurses and staffing agencies. But Porter says more education and support is what's needed to fill the roughly 12,000 openings in Texas long-term care facilities and to keep them in the industry long-term. It's why her association launched the National Institute of CNA Excellence this week, starting in Texas. They plan to pair interested students with a local facility and with a mentor to help support them during their first 2 years on the job.
And not just pair them, prepare them.
Avery Travis, KXAN News.
Porter says more than 100 Texas facilities have signed up to be part of the NICE program.
Now here at KXAN News, we've been tracking the way these long-term care facilities have been dealing with outbreaks of COVID-19, and it seems our state has landed on the national map. According to the New York Times, 6 nursing homes in Texas were in the top 10 for worst outbreaks nationwide. In the first year of the pandemic, the news organization tracked COVID cases in nursing homes. Facilities in Plano, White Settlement, and Southlake had the top 3 highest number of cases. Dallas and Temple, Texas also made the list, while Hearthstone Nursing and Rehabilitation in Round Rock was number 9.